We're going to talk about the function of the pelvic floor now. So there's top 5 function of the pelvic floor, and the first one we're going to talk about is support. The role of support of the pelvic floor is protecting connective tissues from excess load. And so basically there's that lovely basket of pelvic floor muscles that supports the organs that we talked about, and it supports them against gravity, it supports them against changes in pressure from the abdominal area, so coming from above, and it also supports the vaginal and rectal walls. Now, looking at the image on your screen with the boats, in the lower left-hand corner of the 3 boats, you are going to be seeing a boat tied with 2 ropes to the edge. In the bottom right-hand corner, you can see the weight of that boat is really pulling down on those ropes. And then that beautiful picture at the top where the water is supporting the weight of the boat and there's no strain on those ropes. Now that's an idea of the boat being the organs, your ropes being the connective tissue, the ligaments and the fascial layers that hold up the organs. And without a strong pelvic floor, you have a lot of a pull down on those connective tissues. But if that pelvic floor, where the water is representing, is supporting the organs, then it offloads a lot of pressure from the organs and the tissues themselves. Now we're going to talk about the second function, which is sphincter control. So we already touched on this a little bit in the anatomy section, but within the pelvic floor sits the sphincters for the urethra and the rectum, which give us control over our bowels and bladder. In order to properly urinate or defecate, we need the pelvic floor muscles to be able to fully relax. As well, we need to control the timing of these muscles and the coordination of these muscles to allow our sphincters to work at the appropriate times. Now, the third function of the pelvic floor is stability in our body. The pelvic floor works with those other deep core muscles to help stabilize our sacroiliac joints. So that's the joint between our tailbone and our pelvis, our hip joints and our low back joints, and our pubic symphysis at the very front. So an effective pelvic floor works with these other muscles to support these joints in a dynamic way to loads on the body. So if we're lifting or we're working out or we're exercising, there's load on our body and our core works very dynamically to adjust to the load. Now, if our pelvic floor is not working effectively, that's where we can end up leading to issues with pelvic, low back, hip pain, or incontinence issues. The fourth function of the pelvic floor is sexual function. So the pelvic floor muscles play a role in orgasm and blood flow during pleasure. They provide tone for the vaginal and rectal canals, and the muscles need to be able to relax fully to accommodate anything within those canals. And the fifth function we have is subpump function. So basically the pelvic floor acts as a venous and lymphatic pump, meaning the muscles help move fluid waste away from your bloodstream in the pelvic region and upwards towards other organs that will filter that.